I will give it just one more minute. Okay, so I'm going to go ahead and get started. I just want to welcome you all to the Rural Communities Access to Service webinar. Sally Shepard and myself, Stephanie Garys, are Early Childhood Technical Assistant Specialist at the National TA Center for Preschool Development Grants Birth through 5. We're excited to welcome 3 guest state presenters to share strategies from their states. From Florida, we have Susan Gage, the Executive Director of the Early Learning Coalition of Northwest Florida, and Herman Knopf from the University of Florida Anita Zucker Center. Speaking on behalf of the Minnesota Department of Human Services, we have Heidi Hagel-Braid, Chief Program Officer from First Children's Finance. So if you could take a moment before we get started to set your Zoom name to your name and your state so everyone knows who is here, that would be helpful. Just please make sure that you're on mute unless you're asking questions. If you do have questions, please feel free to use the chat. We have reserved time at the end of the presentation for questions, but we will also be monitoring the chat throughout our time together. Also, the webinar is being recorded so that we'll be able to make it available for folks who couldn't join us today and for your reference for later. So the objectives for the webinar are to provide you with some examples of how to quantify access by using data and to provide you with some strategies for improving access to early childhood programs and services in the rural communities. So for the agenda, Sally and I are going to provide an overview of rural access, and we'll be including some examples of how states have quantified their data. Then we'll move into state solutions. I'll be providing a summary of a research report that was done in Pennsylvania on home visiting and adaptations in rural communities. Then we'll move to Florida and Minnesota. And as I said earlier, we will have time at the end for questions and discussion. I do want you to know that throughout this presentation, we will be providing links in the chat, but we also have all of these links at the end of these slides for those that couldn't attend and for you for your future reference. Okay, so we're going to start with a poll question. So what percentage of your state is considered rural? You can go ahead and launch the poll, Carla. Okay, so it could be, greater than 80%, 20 to 39, or maybe you don't know. We'll just give it another minute. Okay. So it looks like we have some people that don't know. So you're in luck. We are going to put a link in the chat, which is to census.gov, which you'll be able to find out what percentage of your state is rural. So if you just want to go ahead and, well, it looks like we still have people entering the responses. So we'll give it just a few more minutes. Okay, it looks like it slowed down. So if you want to go ahead, Carla, and share the results. Okay. So we have a pretty wide variety. We do have people that don't know. So I encourage you to go to the link that we put in the chat, and you can look up and find more information about your state. Okay, so let's go to the next slide. Okay. So we're talking about access in rural communities. So what does that mean? Access to early care and education means that parents with reasonable effort and affordability can enroll their child in an arrangement that supports the child's development and meets the parents' needs. Access for care for children and families should be available with reasonable effort and affordability. This includes access to mental and physical health supports as well. And we have included in the chat the report where this definition comes from, in case you would like to review that as well. So access to health and childcare are critical concerns in rural communities. The Rural Health Information Hub, which is a website supported by the Health Resources and Services Administration of the United States Department of Health and Human Services, includes a discussion about the barriers to healthcare access. Some of the concerns for families include traveling long distances and privacy concerns. At the same time, there's also workforce shortages in the rural communities. There have been 2 recent studies on childcare access in rural communities. One comes from the Urban Institute, and one was sponsored by the Office of Planning, Research and Evaluation, authored by Child Trends. These are just a few of the findings of the reports, and the reports go into much greater detail. I really encourage you to take a look at these reports. The links are in the chats. They have a lot of great information in them. So, for a provider opening a child care center in rural areas, it may not be economically viable if there aren't enough working families with young children. For families, they may work non-standard work hours and may benefit from additional access to childcare offering those hours. So while the report did not note a difference in the educational attainment between center-based teachers and caregivers in rural versus urban areas, it is suggested that the ECE workforce in rural areas may benefit from additional professional support, such as involvement in quality initiatives and professional organizations. So I'm going to turn it over to Sally.
Thanks, Stephanie.
Next slide.
Yeah, thanks. Partnerships can be a cornerstone for increasing access in rural communities and showcase ways programs can work in a cooperative to benefit children, families, and the community. Partnering between early care and education programs can benefit both the families and the early care and education program themselves. So for example, partnering may allow the availability of slots to increase, and this would allow more access for families, but it would also be a potential income increase for the programs. Partnering with other agencies and between early care and education programs can provide additional services to children and families within the partnering programs. For example, the Early Head Start and Child Care partnerships ensure the full day, full year child care needs of families are met, and that Head Start's comprehensive service focus, which includes family support and connection to health and other critical social services, creates expanded services for all children in the program. Partnerships can also decrease the duplication of services offered from multiple programs. Again, the Early Head Start and Child Care partnership is a great example of this. Another benefit to families is that partnerships may allow families the access to the services that they need, and so that they would be able to pick and choose from some of those services. And partnerships may also include the provision of Part B special education services or Part C early intervention provided in the early care and education program the child is currently attending. So there's no need to switch programs or move between classrooms. Partnerships among agencies and programs can also help to address the issues in rural areas, such as the child and family's access to mental health services, the family's access to educational and workforce supports, and the transportation services to all programs that are participating in the partnership. Stephanie, I'm going to turn it back over to you to discuss how the use of data is critical to access.
Great, thank you, Sally. So we have discussed what access means, what are some of the concerns, and preview some solutions. Each of the speakers from our states will discuss how they use data to identify the initial need in their communities. So we did want to review some additional sources of data to assist in pinpointing some rural access issues. So preschool development grantees have conducted needs assessment, and many other states have also. You may have the information that you need in a needs assessment to identify what is needed, or you may need to dig deeper. Other states have conducted risk and reach studies. A risk and reach study identifies specific indicators of risk factors that affect child well-being and development, looking at this from a geographic standpoint, and matches this to the reach of publicly funded programs and services in the same geography. It is a project or study that analyzes data in specific areas. It can be used as a tool by stakeholders to better inform policy and funding decisions. So for example, in 2016, Louisiana wanted to know how they were doing with early childhood well-being. They determined the risk factors. So they did an analysis on 12 indicators of early childhood well-being. For example, one was the percent of children under 5 living below poverty. Then they wanted to look at what services are currently provided and what are the gaps. They looked at the availability of 7 publicly funded early childhood programs by parish in conjunction with the risk factors. They ranked the parishes as low risk to high risk. High risk was the young children in that parish are at risk of entering school already behind, remaining behind, or failing to achieve positive outcomes in school and beyond. They learned that, and remember, this was in 2016, that for the state as a whole, nearly 37% of all children under 5 live in 32 parishes that are either moderate high or high risk. So we're going to go to the next slide, and I'll share another example. So some of these studies, some of the risk and reach studies also look at funding in relation to the programs and geography. Colorado wanted to establish the level of need in the state for early childhood mental health services. So that was their risk. Next, they wanted to understand the reach of the current services. Where are the services in the state, and how do these services compare to the risk profiles in the communities? Colorado also wanted to understand how this work is being funded. They wanted to provide an analysis and guidance on what funding could look like in the future. So you can see here on the slide, you have the risk indicators that they used, as well as the services, that was the reach that they reviewed. They also then matched this to the funding each community needed. So a risk and reach report can be tailored to what the state needs. So let's go to the next slide. This is really an informational slide. We just want to show you a few examples of risk and reach reports, kind of see that each state can kind of tailor them to what they need. Sally is putting all of these links in the chat for your future reference. The last two are not risk and reach reports, but if you're really trying to look at childcare access, these are some websites that you can take a look at how these states have shown that. Okay. So let's go ahead and move to the next slide. We're here. So before we go to our state speakers, I had wanted to highlight a study that was completed by the Children's Hospital of Philadelphia's Policy Lab. It was entitled A Community Capitals Framework for Identifying Rural Adaptation in Maternal Child Home Visiting. They wanted to understand how home visiting programs were meeting the needs of rural communities. So I wanted to share a few takeaways. They interviewed 150 people in 14 counties. They did look at 3 counties that were urban in conjunction with this study. The interviewees not only included the home visitors and the program administrators, but they interviewed the families as well. This helped them to understand the delivery and the receipt of the home visiting services. The interviewees identified the barriers that are faced, such as accessing employment, lack of transportation, and lack of social interaction. The analysis found that home visiting programs work to address the community barriers and adapt their program content to meet the needs of the families in rural areas. Basically, in the rural communities, the services offered by the home visitors reach beyond their typical maternal and child health care. So because of the obstacles that the recipients of the home visiting programs face, the home visiting programs adapted. Some hosted game nights or enabled parent organized social events. One program purchased a van to take families to appointments. In the report, clients said that the opportunity to plan and execute social events while with other parents built confidence and helped them communicate with the other parents in the community. One home visitor described the importance of the events by saying, "You can just tell this kid is just around too many adults and just needs to get around a child. And so at this social, you take that child and their eyes just light up and they're all of a sudden social and interactive like you've never seen it before." So you can see that while planned playdates are part of some of the home visiting curriculum, they really take on a very powerful role in the rural setting. Another solution that I found interesting was the co-location of two home visiting models. While this was found in the urban communities, this could be a good solution in rural settings as well. Each of the McBee-funded home visiting models are designed to reach a specific population. So by co-locating, you can provide a continuum of care for the clients. So for example, if a client completes one model's curriculum but still needs support, they may be able to transition into the second model. Additionally, they could also increase the number of families served by implementing two models with different eligibility requirements. So we are dropping, there are two blogs that discuss these two reports that we're going to drop in the chat if you want to read more about it. Another resource that we're putting in the chat is one that provides examples on rural home visiting programs. And this is from the website that we spoke about earlier, the Rural Health Hub website. So there's some really good examples in there if you're interested. Okay, so we are now going to move to our state speakers. So I introduced them briefly earlier, but let me do a formal introduction. So first we have Susan Gage, the Executive Director of the Early Learning Coalition of Northwest Florida, and Herman Knopf from the University of Florida, Anita Zucker Center for Excellence in Early Childhood Studies. So I am going to turn it over to Herman.
Okay, I need permission to share my screen. Okay, thank you for having me today. I'm going to talk briefly about the Sunshine State Early Childhood Information Portal, which is a product that is a part of Florida's preschool development grant that is developing an early childhood integrated data system and associated products to help local and state policymakers make informed decisions to support better access to early care and education services. We're going to focus in on the Early Learning Coalition of Northwest Florida, which Susan Gage is the CEO, to try to keep everything together for you as we're going through. But first, let me provide a brief overview of what we're looking at in our Florida Index for Childcare Access, or what we call in Florida our FLICA. This is the version 3.1, and the FLICA is designed to help identify the extent to which children and families have reasonable access to high quality early care and education services that's going to meet their need, consistent with the definition of access that Stephanie shared earlier. To do that, we've constructed two measures of access, the first being infrastructure, which is, you know, as other folks have referred to as our TOPS per slots kind of a measure, where we look at the number of children that are accessing childcare services in a particular geographic area, and we compare that with the number of available high quality spaces that are available within that same geographic area. I want to take a minute to distinguish what we're doing in the state of Florida compared to some other models that some of you guys may have been exposed to, is that we're using real administrative data that is capturing the number of children who are actually using services, particularly our child care subsidy program in the maps that we're looking at now, to estimate our use of early care and education services within a geographic area. We also know the choices or the actual enrollments of those children within those communities. And so that we're pairing together the number of children that are attempting to access services within a geographic area, combined with where they actually went. And then we show the selection measure, which looks at the utilization rate of high quality services within a geographic area. To understand the color coding that we have here is that if a zip code or geographic area is colored blue, it indicates that we have ample infrastructure and positive selection. And so families are making good use of that high quality infrastructure that's available. In the opposite corner that's shaded dark red, we have both infrastructure is at a deficit, indicating that we don't have enough high quality supply based on the demands expressed by child care enrollment in that area. And as a consequence, in most instances, our utilization of high quality services is low in that geographic area. Moving up to the dark purple area is that that's showing us that while infrastructure is negative, so we don't have enough capacity to serve all of the children that are enrolling in care in that geographic area, parents are making good use of that care that is available within the area. And so that's a situation where we have high demand or high utilization of high quality services, but we still have inadequate infrastructure. In addition to the maps, we have built in some functionality for our local early learning coalitions in Florida or local policymakers to change the threshold of our class score, which is the uniform measure of quality that we're using in the state of Florida, so that they can look to see how things might change if we were to increase the class threshold within a geographic area. And as you can see, once we move from 5.0 to 5.5 in Northwest Florida, we see a dramatically different picture of access for children and families that are using subsidy within Northwest Florida. But there are limits to the coolness of what we can do with administrative data, as while we have a lot of information about the community and where children and families who are using child care subsidy to access care are using that subsidy, and to be able to describe whether or not they have an opportunity to enroll in high quality care, this breaks down when we start to understand the situation for children and families that are living in rural communities. One of the reasons why we've selected to highlight the work being done in Northwest Florida on this presentation is this is an area that has a lot of rural geographic areas. On the maps, the areas that are highlighted in yellow are areas that don't have providers available. Therefore, we don't have any data to use to measure whether or not there's access, but by definition, there isn't access if families are living in these communities, but these are highly rural communities. And so it really takes the intent and the focus of a local policymaker or local actor to dig in deeper to understand the situation on the ground at a ground level. And with that, I'm going to turn it over to Susan Gage, who is the CEO at the Early Learning Coalition of Northwest Florida. And she's going to talk about strategies that they've used to look more locally at access to early care and education in Northwest Florida.
All right, thank you, Herman. It's always a pleasure to work with you and your team. So what we're seeing right now is going to be a series of maps that after Hurricane Michael hit our service area, and we were direct hit for Hurricane Michael, which was a Category 5, we recognized that everything that we thought we knew probably was going to be thrown out the window because of this natural disaster. So we got on the phone with Herman and said, Herman, can you help us get us a visual of what's going on so we can start to talk locally and at the state level about the kind of help and support that we need? So Herman and his team came up with these really great maps, and we're just going to kind of go through the series of 3. So this one is showing license capacity, and you can see in Bay County towards the bottom left there, that is our, if you want to call it an urban area, you know, urban's relative, kind of depending on where you are, but that's where the majority of families, our parents, adults work. And you see the 6 counties that surround Bay County are rural areas, but most people, if they're working, they're probably working in Bay County and they're driving into Bay County, or they are working local in their county. So if we can go to the next slide, I think it's going to show us the path of Hurricane Michael. That straight line, or diagonal line rather, is the path that it took. And for all intents and purposes, that was total destruction in Bay County. The programs in the darker orangey areas did receive the majority of the damage. And then from the yellow to the gray, just a little bit of or lesser damage, but nonetheless localized damage. So you could assume if you were in Bay County, you probably were closed for an extended period of time. And when I say extended period of time, we still have providers that still are not open, and it's almost 2+ years since Hurricane Michael. But just because you weren't in the direct path of the storm, it did not mean that you did not receive some localized damage, trees, wind, debris, things of that nature. So if we can go to our next slide. It's showing the license capacity displacement. And again, that red number just kind of highlighting the sum of the displacement by the zip code you see in that area in Bay County. But drawing attention to the outlying areas, we'll start to see as we go into the presentation how we had to pay attention. Yeah, we knew there was a problem going on in Bay County, but we also had to start to look at what was going on in our rural counties. And that's where I think where Herman was saying, your local boots on the ground kind of people have to understand what's going on. And you'll see how we were able to leverage the information that Herman and his team was able to provide to help us make decisions for where and what to do to help our area recover. So if we go to our next slide, what we knew after Hurricane Michael, again, everything that we knew before Hurricane Michael was probably out the window. So we had to pull everybody together. And you know, when you're talking in a rural county or rural counties, when you say everybody, it's whoever is going to come and visit and willing to talk to you about it. So we did an all call for people. We did meetings. We showed the maps that Herman had and his team had developed. We did a community engagement with local stakeholders, community members, dignitaries and legislative people, whoever would listen to us. We needed them, we needed them there, and we wanted them to have a part of the process. And then also our partner collaborations with the other entities in those 7 counties that served the families that we serve. We go to our next slide. And after a lot of meetings at some very interesting places, because you met wherever you could find space, we came up with some initiatives. And really, we have to give a shout out to the Florida Office of Early Learning and their team for helping us come and craft our plan to be able to utilize some disaster recovery assistance dollars that they were able to help us get. So what we had landed on is that we recognize that because so many children, whether they lived in a city or in the rural areas, were in a center-based setting, that if we would have had more family childcare home providers, we would have probably had the opportunity to have these children back in care, and families could have gotten back to work, and communities could have more quickly started to recover. So we decided that what we needed to do was hire a provider recruitment or retention specialist to focus on some very specific groups of providers. primarily focusing on providers who were already in business in family childcare homes. They were already in the childcare business, but they were not part of the subsidized or the CCDF funded school readiness program, where we have a specialist who works directly with them to get them on board to want to come in and be a part of our CCDF funded world that we have. We also have our specialist. Her name is Kate. She's wonderful. She's also working with family childcare home providers to help them become regulated. Florida, you can have regulated or non-regulated. And so we want to be able to have regulated providers so they can do the CCDF funded care and offer the services. And also she is working specifically with providers. And we found this in relation to COVID and the pandemic. Some of our providers, whether they're rural or they're family childcare home, their business practices are just, it's been very hard for them to sustain their business. And so she has spent a lot of time working on business practices, and we'll be doing a business practices fall conference this fall in 2021. One of the other pieces that we did is we took one of our quality specialists that we have, and we pulled her out specifically to work with family childcare homes. So she becomes a subject matter expert in all that is family childcare home. And then for our area, that was just something that we have never done before. So we were very excited to be able to do that. Let me go on our next slide. One of the other, with trauma comes mental health, and we knew that most of our mental health service providers were out of the Bay County area, and they were decimated as well and dispersed across as they recovered. So we started to figure out, we're really going to have to think of something innovative to do to be able to help support our rural areas with mental health. The number of mental health therapists was decreased. And then you had all of the challenges that rural areas have in accessing mental health. So what we did is, if we sat down with our partners and said, if we could mitigate or we could take away some of the challenges, what were those challenges and how can we take it away from them? So we decided, instead of contracting with an entity to contract with a provider, that we were going to a mental health provider, we were going to directly contract with the mental health therapist. So we are up to 5 licensed mental health providers who are doing a wide range of services on site at the child care programs or through telehealth. And with the telehealth, we actually provided telehealth equipment and the program to do the virtual access to all of the contracted childcare providers, so that regardless of the family, the teacher, or the director's ability to go to their office, they were able to have access. And again, some of these families that's as much as 65 miles away that they would have to drive. 120 something, 30 something if you're doing round trip. And that's hard sometimes for a family. In addition, we are also a Help Me Grow entity. So we work with our Help Me Grow staff to provide case management for children who are not eligible for that CCDF funding or this program. So what we have is a holistic, comprehensive set of mental health services for teachers, for directors, for parents, and for children, provided by licensed mental health therapists who actually have childcare backgrounds. Many, I think 3 of the 5 that we have right now actually started in early childhood education, so they understand the stresses that are going on. And we took away the barriers. They don't have to pay for it. It doesn't matter if they have insurance or not. They just need access to these therapists, and these guys are jumping. They stay very busy, and actually have a request to get some more therapists in our program. So who knows? Let's go to our next slide. We'll talk about, again, supporting our providers with the mental health. You know, those of you who deal in rural areas, you know that sometimes you are resource poor. And so we had to think about, okay, if we have a limited number of therapists who can get on site, how can we help start to build capacity for our childcare providers so that they can make it through until the therapist is able to come on site or until the formal intervention starts. So we are working on building the internal capacity of the childcare providers. And we are doing that in a couple of ways. The first way we'll talk about is that we've hired 4 mental health specialists who are actually on staff with the Early Learning Coalition. And they go on site. They are the ones who will conduct initial evaluations, help with class management, room arrangement, or provide that listening ear and guidance for that provider, while the teacher, while the family is waiting for that more intense work with the therapist. So what can we do to build their resilience and their resistance until the experts can get in and work with them? And we go to our next slide. One of the things we're also doing is working with the Florida Office of Early Learning in adapting and bringing the pyramid model of helping with child behavior in the classroom to very targeted, very specific programs that are located in very rural areas that do not have any specialists or any of the licensed therapists that are there. So we've identified two child care centers to do that. And we're also working with one of our rural Head Start programs in their child care centers to train their center staff as specialists in the pyramid model. This is a multi-year pilot program that we're working with Office of Early Learning, and it is hot and heavy underway, and everybody seems to really be responding very positively with that. In addition, working with the Department of Children and Families in Florida for trauma-informed care. We are paying for the cost of that training for any director or teacher who wants to receive that. In addition, providing them a stipend as they complete that process. All right, next slide. So some of our big lessons learned, and again, those of you who work in rural areas know you've got to ask the right questions. And the first question you never ask is, can we afford to do this? Because the answer is always no. It costs more to do this in a rural area than in an urban area or even a suburban area. So we quit asking that question. We quit asking, can we afford it? And we ask the question, what can we not afford to lose? And when we ask that question, we recognize we can't afford to lose the care and the supports for the rural families, i.e. we cannot afford to lose the child care center or the family child care home in that rural community. So by flipping that question, that kind of realigns our priorities, and we start to figure out creatively, how can we keep who we have going. And when we consider the real impact of losing one provider, a couple of our counties, they have 2 providers. And so when you lose one provider, you've lost 50% of the licensed capacity to serve families. And that's just something that we can't afford to lose. So here at the coalition, we are really, really working to maintain the providers that we have, grow new providers, get more people into the fold, and just continue to do the work of growing healthy children, parents, and the relationship between them. And I think that's the end of mine.
Okay, thank you, Susan.
You bet.
Okay, so we're going to move on to Minnesota. So I'd like to introduce Heidi Hagel-Braid. She's the Chief Program Officer of First Children's Finance. The First Children's Finance Rural Child Care Innovation Program is funded by the Minnesota Department of Human Services. And I'd also like to mention that First Children's Finance is also a TA partner with the Early Childhood Quality Assurance TA Center. So I'm going to turn it over to you, Heidi.
Thank you so much, Stephanie. Really excited to be with you today and to share a little bit of information about the Rural Child Care Innovation Program. First, I think it's important to note, as Stephanie stated, that I am not of the Minnesota Department of Human Services. They contract with our organization to deliver these services. So we are a national nonprofit headquartered in Minneapolis, Minnesota. We serve multiple states and, as Stephanie mentioned, serve as a partner federally with the TA Training and TA Center. But back in the day, I was a farm girl, and you can take a girl off the farm, but you can't take the farm out of the girl. And as I entered the early care and education field, it was immediately clear to me that supply building in rural communities is a different animal, if you will. It has a different set of challenges. It has a different set of assets and requires a framework that is built on the philosophy and framework of identifying strengths in rural communities, building on the assets, the social capital and will to be innovative and creative, and to think about community-based solutions. So the Rural Child Care Innovation Program has been piloted in 2013, has grown, shifted, and changed over the years. But what is true then is true now. It is a community engagement strategy that increases the capacity of rural communities to build the supply that is needed as an economic development strategy. But what we heard earlier about mapping from previous speakers is important and relevant here, is that you have to build right-size solutions that take the local market, need, supply, and demand into account. And so you must start with a really sound idea of what the demand for childcare looks like, what the current supply looks like, what that supply operates as. Sometimes in rural communities, that looks and operates differently than perhaps you might imagine at first glance. So you really have to dig into the data. And one of the most important things is to try to get to the most local source of data possible. So even though we start with the American Community Survey and any of the databases that are available, what we know about rural data is that it can have large swings in what is relevant as it ages. And so as best you can, we encourage you to get close to the ground and identify what kind of data is available to you, and look at multiple sources and identify a target of what it actually looks like, because data will not always land at the same point. There's not going to be just one number around supply and demand. And if you know anything about childcare, you know that the life cycle of childcare businesses shifts and changes all the time. And so it is important to sort of keep open the door of a range, a demand number that you are looking for, so that you can identify the right kinds of solutions that will be financially viable over time and sustainable in that community. So as you think about the identifying the precise rural childcare data, think about where those gaps are, where those needs are, and make sure that you are building the right kind of solution. So look at all things, including family childcare, specialized family childcare, school-based programs, childcare centers, and make sure that you are looking with differentiation across an entire region or an entire county or an entire area, because a small population center can skew the results. So really get as close as you can to the ground. I'm going to give you a really concrete example. In Minnesota, school districts are required to do a census that they submit to the Department of Education, which is actually not connected to childcare at all. But in very small towns, I have actually met the woman who does the census. She carries around a little notepad and she stops by and has coffee every once in a while. This is, of course, in the before times, pre-COVID. And people would say, oh, did you hear that the Johnsons are having a baby? And she would write that down. And their census was very accurate, but it may not exist on a lovely, sophisticated map. Sometimes you're going to have to find the person who has the notepad of who is expecting a baby in the community. As you look for the community engagement process that we use in the RCCIP project, it really is identifying unusual suspects to think about childcare and the needs that impact not just parents and families, but the local economy, local employers, government, anyone who cares about the health and vitality of a rural community also should be talking about childcare. If you want to attract and retain families to a community, they need a job, they need a place to live, and they need high quality childcare that allows them to be at work and be productive at work. So this is the foundation of all of our work inside of the Rural Childcare Innovation Program, is to identify what the gap is and then collect additional impact and information from the community. If you could go back to the first slide, I think there's a couple points that we could go to. So we've been doing this for a while. We have partnered with 31 communities across Minnesota. And in that time, these are licensed slots that have been created. We date stamp every community that we work with and every project that comes out of this work. And the runway sometimes can be longer than your project. It takes a while to renovate a home or get a license or construct a facility or do an expansion to an existing building. So we talk a lot about the preservation of slots. We talk a lot about community collaborations that could extend slot creation more quickly. And we have had an enormous amount of people involved in community conversations about childcare who typically come to the table without an understanding of the important role that childcare plays. At the same time, when we do this work in communities, we attempt to engage existing providers, because the last thing that you want to do is send the message that we need more childcare and you guys who are doing it, oh, that you're old hat, we don't need you. They are the people who are your most likely candidates to grow their programs, to move from a family childcare to a childcare center license, who might be willing to expand their facility or set up another location or to engage in a new partnership with a community partner. Those are the really great folks that you want to prime to take advantage of opportunities as that community identifies its need for childcare. Don't forget about the existing providers, because they are your best bet for people who know how to do this work well and might be ready for a new challenge. Now we can go to the next slide. So as we talked about, that precise data is really important to be able to zero in on. And I was asked to share a couple of success stories. And the one that I always like to talk about is Kandiyohi County. And Kandiyohi County has a population of about 42,000 people. And when we did an analysis of that particular community, it had somewhere in a range of 776 slots that were needed, given the projected birth rate, the demographics of the community, the commute shed, the labor shed, and the amount of licensed care that acted and operated like childcare in the community. So across that county, they needed a particular set of circumstances that were going to address that need across a larger geography. So in the RCCIP, the community has a local leadership team that spends a significant amount of time identifying the data to identify that need, and then also to gather input from stakeholders, from parents, from community partners, elected officials, others, about how childcare is impacting other parts of the community. And at the end of this study, we host a community town hall where many, many people come together to give their ideas about innovations and community-based solutions that can address that particular need. So in this community, they had 9 goals. That was a very large amount of goals. We usually see fewer, but this community, Kandiyohi County, had about 9 goals that had a great range included in them. To date, as of July of 2020, their progress report includes the fact that they launched an early education course at the nearby community college that had been lacking in demand. They created a scholarship program to subsidize current and potential ECE workforce folks coming into that program to get credentialed and advanced education. They also partnered with a local childcare center to create lab and experiential learning experiences to augment that curriculum. Also, we have seen in the time that this project has been active, 12 new family childcare providers. When a new childcare provider is licensed in Minnesota, they have a provisional license right away of 10. And on average, they could go up to about 12 as an average enrollment number. So right there, out of the gate, there's about 120 family childcare providers who were created. And there is a new childcare center that already has been opened that has 74 slots across different age groups. There is currently another childcare center in another part of that community that has been doing significant fund development to launch its own licensed childcare center. And we will see how that comes along, as that project has probably hit some setbacks during the pandemic. But the Early Head Start Childcare Partnership and Early Head Start has identified and expanded to serve 24 additional infants and toddlers in its program, which infant and toddler slots in a rural community are like gold. So when you are able to identify the data and be able to put together a community process that allows many voices to identify innovative and creative ideas, you can see significant results that come out of these plans. I think we can go to the next slide. So my best advice to you is, as you mobilize and operationalize the data around demand and gap and identify those solutions, is really to garner support from the larger community, people that we classify as the unusual suspects, to understand how childcare impacts their local business, the bottom line of employers, the regional economy, school readiness, health and community vitality. Any of those people who care about that should also be thinking about childcare as an economic development strategy. We are seeing all kinds of, as an example, infrastructure spending bills in Congress right now that include childcare for the very first time. And so we have been borrowing that concept for many years, thinking about how to position childcare as not just a young family issue, not just a mom issue. Really thinking about it as an economic development strategy allows it to be not a family choice, but an infrastructure choice for a community. I would also recommend that you leverage the community expertise and resources. So look for local leaders to carry this work forward. What you don't want to happen is when you leave town that all progress stops. So really engaging the community, educating them about this issue, giving them a roadmap for change, and supporting their implementation. That community solution action plan, that's what we use inside of our process. And I think there's a link in the chat that's coming that'll give you a way to download any of the existing community solution action plans that are current in Minnesota. And then think about how you can leverage existing facilities, especially for family childcare, particularly if your state allows for non-residential family childcare, or family childcare that can happen in place that isn't a home, or to think about how you can leverage any existing community for childcare. We think we have to construct brand new buildings that only have one use. That's not true. So think about how you can embed childcare in housing projects, in Main Street, things that are sitting empty, and look to local employers, government facilities, and others for viable facilities that might house family childcare and childcare centers. And then finally, think strategically and innovatively about ways that will preserve the existing supply and also add new slots and new childcare businesses to communities. Those strategies might be more financial in nature. So can you create a forgivable loan fund in your community? Can you create local funding mechanisms, local policy, or local partnerships that subsidize or lift the burden off of childcare businesses to make them more financially sustainable and therefore more likely to operate in your community? There's lots of amazing stories to be shared. You can find some of that on the website located in the chat. And I'm going to pass it back to Stephanie at this point to carry on with the rest of our presentation.
Great. Thank you, Heidi. So we have time now. We kind of intentionally scheduled the webinar so we would have time at the end for questions and for discussion. So You can take yourself off mute if you would like, if you have any questions for any of the presenters. Or you can put a question in the chat.
Hi, my name is Travonda Davenport. Can you hear me?
Yes, we can.
Okay, my name is Travonda Davenport and I am in Nashville, Tennessee. And I work for a program called TEC, the Tennessee Early Childhood Training Alliance. And we work with family child care providers exclusively. My department is family child care. One of the barriers that I have had since working with family child care providers in the rural community is the lack of internet access. So there's been huge issues. There are always requirements by DHS to send in paperwork, you know, different things that are required by licensing, right? And so there's always an issue with them not being able to get the paperwork in because of internet access. And even with TECTA, you know, our world is technology. And so even with the communication issues, they're not able to join the Zoom meetings, they're not able to send in the paperwork. And so internet is a huge, huge issue. And I've just really been trying to rack my brain with how can we, a lot of my staff have driven far to go pick up the paperwork, walk them through the process of signing and filling out the paperwork. But there's a continuous issue of internet access with rural providers. Have any of you all come across this barrier? And if so, what are some innovative ideas that you have come up with to try to help keep them in the know of things that are going on?
Okay, so I'm going to see if Susan or Heidi have any experience with this.
So this is Susan. We have, and this, it for us, it kind of goes back to asking the question, the right question, instead of, what the status quo isn't going to work. So what can we do, right? We know this is a problem. What kind of resources and time and efforts can we put to this? And so we have sat down with the providers and asked, is it that you cannot afford? Is it that there is not the capacity or the infrastructure in the rural area where you are? Do you have a cellular phone with those kind of capabilities? So it's taking that one-on-one approach and empowering the family child care home provider, and in some cases the rural family child care or rural center-based provider, to work with us to come up with a solution, so she can tell us that she's tried this or she hasn't tried that. And we just try to keep as many roads open as possible and continue to work with them to reach that endpoint of being able to utilize technology to be able to take place of, or to do the business that they need to do. We recognize that there are barriers. I live with spotty connection because I live in a rural area, but I just can't pretend that this was not a problem that I cannot plan to solve. So if I have to do extra mileage to go pick up some stuff every once in a while, that's just something that I need to do. If a provider says, Ms. Susan, there's a new internet rural provider, but I don't have the startup money, is there any kind of special grant or something that I can? It's just, what can we do to reach the resolve? And it's not going to be a one solution fits all for all of our providers in our 7 counties.
Okay. Heidi, do you have anything to add?
Yeah, I would echo everything that Susan just said. And I think her point was spot on. Ask the right question. What is the barrier? Is it financial or is it infrastructure? And then I think we've seen some success here in access to online trainings too, is that if it is an affordability or an access issue, who has the access? And then look for those rural partners. We have seen local banks who will open up their conference rooms or their board rooms in the evening. Local employers who do have that access are creating access for them, the providers, to come in the evenings to be able to log on or to do what they need to do. There are ways around it, but I think Susan's point about ask the right question first, affordability or infrastructure is key.
Great, thank you. And in the chat, a couple of people responded to, Valerie said that some folks that she's worked with, they use the local library computers. And from Nebraska, someone said, which is kind of similar to what Heidi said, that there's a phone company that offers free internet for families. So
Stephanie, I would just add that we are at a crossroads when it comes to broadband access for rural communities. And if your typical partners in your day-to-day operation is not those people who are advocating for broadband access, I would seek out who those people are and start to form a relationship with them so you can add the perspective of childcare and your area of expertise to theirs of broadband access. The more oomph we can get behind the argument, hopefully in this change that we're in, they'll see that this is just as critical as electricity was back in the 30s and 40s. Nobody questions that now. I look forward to a day when nobody questions broadband access across the United States. So.
Stephanie, I'd like to respond to a question from Jen Pishney from Kansas.
okay.
She was asking how others are collecting childcare shortage data. The number of B-5 children minus the number of slots available in a particular area is not an accurate picture. And I just want to emphasize that Jen is absolutely right, is that every person represented within the census data is not necessarily on the hunt for early care and education services. And it is important for us to look either to child care resource and referral agencies if they have those data available, or as we do in Florida through our partnership with the Office of Early Learning, to access real enrollment data or inquiry data, rather than trying to use generalized census type data, because that does present an inaccurate picture of what your demand might be. And we're also seeing that childcare utilization rates vary by community characteristics. And so people living in certain communities behave differently than people living in other communities. So using those generalized approaches really break down when you're trying to intervene to provide better access to services.
Okay, thank you, Herman. So we do have one more question, but I did want, actually we have a couple more questions, but before we get too far away from the internet, I do want to say, if you want to look in the chat, Travonda, someone else also put in there that the FCC announces availability of emergency broadband benefit program. So you might want to take a look at that. And then Joy from Michigan said that they have folks that go out with hotspots and computers to assist their families. So, and also there's partnering with local schools. So we have a question to the presenters. Oops, sorry, let me get back to that. I apologize. So let's go ahead and start with Heidi. The question is, what you have found to be the biggest obstacle when trying to support or create innovative solutions to providing childcare in rural areas?
One of the biggest obstacle, you said?
Yeah.
The biggest obstacle. I would say in rural communities, sometimes the largest obstacle is facilities. And so the way that you have to tackle that issue is through community partnerships with the folks who have facilities that may be underutilized or not utilized at all. Housing prices have been increasing. Communities that are experiencing growth have housing shortages. And so I think you have to look for partners who have facilities to be able to think creatively about childcare. So I often hear from folks who say, oh, well, Heidi, we're a mining operation. We can't put childcare in a mine. And I always say, I'm not asking you to put childcare in a mine. What I'm saying is there's somewhere in town where you own property, and I want that spot used for childcare. So look to the local hospital. They often buy blocks and blocks of homes that are not being utilized as housing. Look to the school district, who may have empty buildings or a wing of a building that is underutilized, who might be interested in some sort of partnership. Look to faith communities who have children's worship spaces that are not being utilized 7 days of the week, who have declining revenues and might look for a tenant. Look for who has facilities, particularly empty downtown, and think creatively about how you can repurpose those areas for facilities. That is the biggest barrier, but it is not something that should stop you from thinking about new uses for old buildings.
Great, thank you. So Susan, would you like to respond to that question as well?
I don't really have much that I could add. I think the key here is to think outside the box and take a chance and ask the question and be prepared for a yes answer just as strongly as you are prepared for a no answer.
Okay, thank you. Okay, so let's see what other questions we have. I know we had a question on, I think we had a question on so someone asked about they're seeing a huge shortage in staffing for centers and people are not going into the field of early childhood. So I know that's a big question. It's a big question. So Susan and Heidi, if you guys want to address this in relation to the work that you're doing in the rural communities.
So yeah, that's a big question around.
Big question.
Yeah. Again, trying things that you haven't tried before to recruit staff, not being afraid to try something that failed in the past to recruit staff, recognizing that there are some things that aren't under, your control. If individuals are choosing to do whatever and not to work, trying to figure out how to ride that storm. I think if there was a magic solution, we would have known about it by now. And I think right now it's just being patient as much as possible, being proactive as much as you possibly can, and have that 3-day, 3-week, 3-month, 3-year plan out on how to do this. But one of the things that we found is interesting, Stephanie, and as we look at rural providers, as we as an organization can elevate the role of the director, of the small business owner, even if that business is in their home, and the professionalism that they should exhibit and they should expect from their families. It kind of sounds tangential, but if this can become a more respected field, and again, we can ride that wave of this is a critical function in our society, childcare, then maybe we can start to turn the tide in how childcare is perceived, and more people will start to see that this is an honorable and critical career to go into. But no magic wands, just lots of optimism and lots of trying and retrying and relooking, and again, working with other partners that we might not have maybe worked with in the past to see if we can get more people into the field.
I would add that everyone knows this, right? This is the definition of preaching to the choir, is you folks. We knew that we had a shortage coming into the pandemic. We know it's going to be bad coming out of the pandemic. So as you think about rural childcare, I think it's important to look at family childcare as a viable delivery mechanism for childcare in rural communities. And there are lots of people who default to a center. So look at ways in which you can promote small business entrepreneurship through family childcare. And also, at the same time, a lot of licensing regulations lock a lot of people out of family childcare if there's not flexibility and innovation around home ownership. And if you don't own a home and you are interested in this business, you need a lot of capital because family childcare may not be an option. And so if we really want culturally and linguistically relevant care that meets the needs of rural families, family childcare is an important option. And you need innovative licensing policies that allow non-residential family childcare to solve for home ownership. As we look to boost BIPOC entrepreneurship, it's absolutely an important thing to keep your eye on. Thinking creatively about the workforce is important. As you look at childcare centers, that's a very different issue. They are incumbent on a workforce to be able to meet ratios and enroll children. And so look to states where there are apprenticeships, where there is funding or student loan forgiveness for education. The Canby, Ohio County example that I just gave you is how can you work hand in hand with a higher education partner to bring people through to certify them and hopefully retain them, and pay is always going to be the bottom line. So community partnerships that help underwrite the operation of childcare businesses allow for some line items to come out of their budget to be more aggressive in pay and compensation. And it's turning the ship. It's not quick, right? We need more public investment in childcare to be able to adequately compensate our workforce. But in the meantime, we have to use everything at our disposal to solve as best we can for that problem and try to attract and retain people into our field.
Great, thank you, Heidi. So we have another question, and I'm gonna go ahead and answer this. In Oklahoma, they talked about there was a law passed that prohibited entities from using federal funds on projects that would produce recurring costs without approval. So they're asking how they can advance projects for federal funds toward crucial capacity building efforts. So for states that are using one-time expanded federal funds to finance projects, how do you talk about planning for long-term? So with in the Preschool Development Grant TA Center, we actually provide assistance with sustainability planning. So if you, Tori, if you would like to reach out to your TA specialist, or we can reach out to you and just let you know, we can help you with that. And I don't know, Heidi and Susan, if you guys have anything that you would want to add from your perspective on that question.
I do not. I think you, good.
Okay. So yeah, so we can definitely help you with that, Tori. And so we have another question. What role do the ECE coaches play in your community as far as program quality and workforce development?
I can take a stab at that one. For us, they are the boots on the ground. They're the extension of the organization into the individual communities. So they're there to tell us like it really is. We're very fortunate that we have people that are caring, compassionate, professional, and will come back and let us know what really needs to happen. So if they come back and they say, Susan, you know, this is a great idea, but it's not going to fly here, and here are the reasons why, then we listen to them and we try to accommodate and you know, honor what they've observed and honor their really that relationship that they've had with that rural provider. We sometimes think, you know, even though we as an organization are in 7 counties, 6 of which are very rural, we still sometimes fall susceptible to the one size fits all solution. And I know I keep harping on that. Be willing to think outside the box, be willing to try something different, be willing to ask the different question, but is the more quote unquote right question about, you know, what do these guys need? And so our specialists are, yes, they know the overall arching quality elements, but they again are putting that personal individualized relationship spin and working with that individual. And we're just really, I think, fortunate to be in an area where we can do that. That might not be the case for everybody, or everybody might not be in that organization. So we just try to take that personalized approach.
Thank you. And Heidi, do you have anything to add to that?
Well, so I'm here as First Children's Finance as a representative of Minnesota Department of Human Services. So I don't want to get too far afield, but in Minnesota, that work is held by Child Care Aware of Minnesota. And that is the core of their work, is all of the professional development, all of the quality rating and improvement system, coaching. So they are integral to that process. But I would defer for additional information back to the experts.
Okay, great. Thank you. So I think we have about 2 more questions. So one is, Elizabeth said, I am hearing about resources available in your areas for supports in data collection. My challenge is access to identifying access to such resources. So Heidi, do you want to?
Yeah, I can give you some starting points, right? So I think you're going to want to first start with any census data, knowing that it changes, it ages, and it does not zero down, but that's a good starting place. You'll also want to connect to your state demographer's office or any other publicly available data sets that you could parse. Your Department of Education may have a charge to serve children 0 to 21 and may have data there. Your demographer may have information about birth rates. I think you're also going to want to figure out where people live and where they work and where they travel for work. That has a lot of information, and typically that is held by your Department of Employment or Economic Development, Labor and Industry. It might be called something else in your state that is slightly different. Looking for information about commute shed and labor shed, or if you have open enrollment for schools, where children move to for schools. Those are really good starting places, and just ask around. Everyone has lots of data. I think you're not going to find one magic childcare data source. So you're really going to have to blend information from multiple sources to be able to paint the picture of what's happening locally for your rural community.
Thank you, Heidi. Herman, did you have anything to add to that?
Just that, establishing partnerships with other service providers, depending on whether we're talking about a local investigation or statewide investigation, is critical if we want to go beyond estimates of population and what may be going on, and really dig into kind of the real children and families and providers that are providing services to children and families. And that, in some of the instances, it's taken us a while to forge those partnerships with other agencies, but long term, it's proven to be very fruitful in helping us understand and be more confident in our understanding of the interplay between need for services and demands for services.
Thank you. So we have one last question. And Sally, I may ask you to help with can you speak to how you frame the CACFP participation as an encouragement for small business entrepreneurship and economic development driver, especially for childcare homes? So.
Yeah, I think Heidi could probably address that much better.
How?
Yes.
When we look at our data as we work with childcare businesses across spectrums, but particularly in family childcare in almost every state where we work, it accounts for 10% of the income of family childcare. So I have a group of providers that I'm working with right now in the Charlotte area of North Carolina. And same thing, held true there, holds true in Michigan, Minnesota, and Iowa. It is on average about 10% of their income. It is money that they are spending already. So it's reimbursement for the food costs that they're already spending. So you can lay that out pretty logically as a revenue source that recaptures some of what they are doing. And currently, starting July 1 of 2020, the CACFP is providing the highest level of reimbursement for the entire year to all family childcare providers. So there are some special provisions due to COVID and economic recovery that they absolutely should be taking advantage of right now.
Great. Well, thank you. And thank you everybody for the great questions. I believe we addressed all the questions in the chat. So I guess we'll go ahead and turn to kind of closing it out. Oops, let's see. Okay, great. So, and we gave you a lot of information today, and I just really hope that one of the messages you take away is that it really is a lot of data out there, and you need the data to kind of start quantifying issues. But you really need to be in the community. The community needs to drive the solutions. So really hope that is one of your greatest takeaways today. We do have, as we said, for your future reference, we have 2 slides of resources, which is basically everything we dropped in the chat. And there's actually like maybe 2 bonus resources in there. And then we do have references for the reports that we quoted. So we want to thank you very much for joining us today, and we hope that you enjoyed yourself too. So thank you. Thank you, Heidi and Susan and Herman, for giving us your time today and sharing the work that you've been doing. Thank you.
Thanks, guys.